Hey everybody, welcome. It's Dr. Brown from KNS Chiropractic, your Baltimore area chiropractor. Today we're here treating somebody that has plantar fasciitis. Chris, tell them what's going on.
I could hardly even walk when I saw a YouTube video of someone getting cupping to their feet. And so I'd already tried a lot of things and I decided that I needed to try that because I could not function. And it's just doing a lot better now after the cupping.
Okay, so what we're doing a bunch of different things to Christina's foot. So she has plantar fasciitis, inflammation that builds up in the bottom arches of the foot. My other videos explain all that. I'm not going to do it. We're just going to do a quick little snippet, just kind of show you a little bit portion, few minute video of each thing we do. First thing we're doing on her is we have what's called electrical stimulation. Electrical stimulation helps to relax the tissues in the bottom of the foot. After that, we're going to kind of work some of these tissues. I'm going to take this massager, which will work some of the tissues, which will help to loosen them up. The next thing we're going to do is we're going to do what's called ultrasound. And ultrasound helps to reduce inflammation in the bottom of the foot. Then we're going to cup her foot, which helps to separate the layers of the tissues there where the inflammation is building up. And what the heck else do I do? After that, I adjust her spine, which I'm not going to show you how I adjust her spine. Other things we sometimes do to people with plantar fasciitis, depending on how they respond, we might do dry needling, might adjust their foot. We'll probably adjust her foot too. I don't know. We'll see as we get in there. But that's the approach that we use. That works. I'm sure I'll get 10 million comments of people that say, that's not the way you do it. That's the way we do it. And we get really good results. So that's what I care about. And that's what I want to show you guys how we're doing it. So we'll see you back in a minute. Okay, now we're just starting ultrasound. So with ultrasound, we put gel in there, which I already did, and we rub this on her foot. And this is a different type of ultrasound than people get when they see babies. That's a diagnostic ultrasound. This is a therapeutic ultrasound. So what this does on this wavelength, this is a very deep heat which reduces inflammation between the tissues, between the joints of the foot. And this is a very important thing when somebody has plantar fasciitis, because you're getting that plantar fasciitis because the inflammation continues to build up between these layers of tissue. So this will help to dissipate that. We also have this ultrasound on a setting that will help to increase tissue healing. And by increasing tissue healing, it'll help to bring blood flow to that area to get the tissue to heal quicker. Some of these tissues in the bottom of the foot are white, and a white tissue has a harder time to heal because it's got a very poor blood supply. So this will help that heal. So we're gonna do it for about, I don't know, 6-8 minutes, something like that, on this foot, and then we will do the other foot. And then when I come back, I'll show you how I cup the foot. Okay? All right, I'm gonna have Kat finish up the ultrasound. Kat, say hi.
Hey.
Kat, she obviously works here, so she's gonna finish up doing the ultrasound for another few more minutes on each foot. She just wanted to get in the video. Right, Kat?
My big debut.
This is her big debut. And that's it. Hey, Chris, real quick, tell him. You were saying that the next thing we're going to do is cupping.
Yes.
Tell him about the cupping.
I just wanted to make sure I said that when it was very painful, as soon as the cups went on, it was complete relief. When they came off, it came back again. But over time now, when they come off, I still have the relief. So that's
I
awesome.
mean, she's doing great. I mean, we were just talking while I was doing some of the ultrasound, and she was saying that she doesn't even realize she has a foot problem anymore, which is great. But that's why I told her she's still got to keep up with some of the exercises and things like that. So anybody that has plantar fasciitis, even though you might not be feeling it anymore, it's something that you kind of want to still stretch, something that you kind of want to still work the tissues. We don't want it to come back because it takes way too long to heal. All right, just finished up the ultrasound. Now we're going to do cupping. So come here, Hannah, show them how I do this. So we're going to put some gel on here so the cups stick. And what the cups do, and it feels really good, is it separates these layers of tissue. Got a bunch of different layers of tissue, gets inflammation, scar tissue, all kinds of abnormal stuff builds up in there. It causes pain. This separates it all, and it feels really good. So this is what we're going to do. This creates suction, and we're going to do it. All right.
Mm-hmm.
You can see how it creates suction in there. And it should feel pretty good.
It feels awesome.
Is that one on the bottom good?
Mm-hmm.
Okay, I'll just here. Maybe we can get, this is our bad foot, so I'd like to try to get 3 of them on here if possible. If we're lucky, we can get this little sucker to stick.
Thank you.
Good?
Mm-hmm.
And that's what we'll do. So creating this suction separates the layers of tissue. It'll get rid of some of that inflammation. It relaxes the all the muscles in that area. It's just a pretty good treatment for the feet. We find it very, very helpful in conjunction with what we're doing. I don't know if cupping itself would just fix everything. That's why we have our multifaceted approach to doing this. And it is very successful. I would say probably 90% of the time people feel significantly better for a long period of time. So that's good. We're gonna leave these on here for about 5 or 8 minutes, and then I'll be back. Okay, we're back. We're gonna take the cups off. Real simple and just create a suction. So here, Hannah, you can show what the foot looks like. You don't really get that bruising or anything under the foot. All this redness and purple and weird looking stuff, that's gonna go away in like 5 minutes. You don't get bruising like if you do cupping on somebody's back or their muscles, shoulders, that type of thing. A lot more softer tissue there, so you can get bruising. You've seen, like, I don't know, a lot of people have, like the Olympics, like with Michael Phelps, when you saw, you know, here's a swimmer, when you saw those cupping marks on his lower back, you don't get that from the foot. But very simple. So anyway, so all these different approaches we do help to heal the foot. So I'm gonna use this instrument, and what we're gonna do is we get along these bones in the foot, and this instrument creates a vibration, and this will help to get some mobility in between all these little bones and all these joints in the foot. And this is just another thing that helps to get the tissue to heal. So we're gonna work along each of these different joints. This isn't really putting the bone back into position, but a high velocity, low amplitude thrust, which this instrument creates, will help to break up the reflex that's holding these tissues tight. So this just helps as well. So we get a lot of people that come in that see our videos and we help them, which is a great thing. So I wanted to do this video to give you guys an idea of how we treat it. And this is basically a lot of what we do. Like I said, sometimes we dry needle and we do a couple of other things. But that's it. Oh, let me grab one thing. Talk to Christina for a sec. So the one last thing that we usually recommend to people are orthotics. Orthotics are insoles that go inside your shoes. And what they do is they help give you support where your foot doesn't have support. It also helps to keep your pelvis balanced. So they come in all different styles. I mean, they have soft ones, hard ones, 3/4 length ones. There's 20 different styles depending on what kind of shoes the person's wearing, what their activity level is. So this is another thing. And we fit people for orthotics here. We have a machine that takes a digital scan of the foot, and that digital scan gets sent over to the company that makes the orthotics, and then they make the orthotic according to the person's foot. So that's another thing that we do. So that's what we do. Anything to say?
I'm just very thankful for you guys and cupping, for sure.
Good. Well, good. She's doing great, as most people do. I will see you next week for another video. Thanks.